Everyone did well? Here's the first thing. Good.
Is that a 3-minute timer or a 5-minute?
That's 5 minutes.
Really? That's
Good.
quick. This is lightning.
Yeah.
Quick for academics.
Hi everyone, I'm glad that you're here and I'm glad that it's 5 minutes. All right, I like this. So I can slow down a little bit. We all know a lot about the power of nature to heal us, whether it's seen from the window or it's hiking in the woods or a piece of Inez's remnant forest. This is a psychological ecosystem service. Doctors have begun to write prescriptions for nature pills based mostly on common sense, and the site's lead rating system now credits unobstructed views of vegetation in support of mental health. And all of this is great, but it could be a lot better if we had more specific research on how much time do I have to spend in nature to get this restorative effect. Everybody wants to know that. And how does the quality of the nature experience influence restoration? Looking at a single zinnia in your backyard versus being in a relatively unperturbed forest near the city. My overarching research question addresses these parameters of a nature pill prescription, which is what I'm after, duration and the quality of nature. And the ultimate goal is to translate these research outcomes so that they are really useful guidelines for the designers and planners who are able to and aim to create urban spaces that offer respite to people. So to this end, I put together an interdisciplinary team and initiated an 8-week field study with participants who agreed to follow the following regime. Go have a nature experience, and that is defined as spending time outside in a place that brings you a sense of closeness to nature, completely subjective. And to do this, at least 10 minutes, at least 3 times a week for the 8-week period. This is an adaptive management strategy that allows us to bring realism into the estimate of an efficacious dose, something that has not been done before in this type of study. It gives people the freedom to customize according to the changing demands of daily life. In an app that I developed along with one of the programmers on my team, we could account for duration pretty objectively. Before and after each nature pill, the participants reported their level of perceived stress, their ability to focus, and their satisfaction with their mood and their energy level. And over the course of the 8 weeks, at 4 different points, people gave us saliva samples that provided a before and after nature pill objective measure of well-being. We measured cortisol, the stress hormone. This is perhaps the most essential type of data because the healthcare community is less inclined to buy self-report data unless it's also accompanied by some objective data. Also, this type of objective measure gets a lot more traction when it comes to monetizing the value of a nature experience in terms of both healthcare costs and policy development. So, how does the duration of a nature experience relate to mental health? Well, this is a small snippet from a fairly large paper that was mostly on methods development, but was able to give us a really, really good result. So after removing the natural diurnal drop in cortisol, it goes down during the day naturally in all of us, after we accounted for that, there was still an additional 21% drop in cortisol per hour, a magnitude that was twice as great as the natural decline in cortisol. That's considered to be a fairly large effect from people that know about these things. So we also found out that the greatest efficiency in terms of duration happened 20 to 30 minutes into the nature experience, with the additional benefits accruing as time went on, but at a lower rate. So that's one aspect of duration. Now the quality. To assess the quality of nature, the participants identified the landscape setting and provided a comment and a photo from a place that made them feel good. Again, another subjective, that's what we wanted. We did find so far that greater restoration effects were reported when people were in small public green spaces or private green spaces like their backyards. For several years now, I've collaborated with Mark Berman and his team in the psychology department at the University of Chicago, looking at mechanisms of visual processing that are involved in our response to nature. One key outcome that has emerged using a method that I developed for cognitive visual processing is that the spatial configuration of a scene has a significant effect on people's response to outdoor spaces, both natural spaces, in-between spaces, and purely urban spaces. So this work is still unfolding, but it's already clear that how we experience the shape of a space, how we are in it and relate to it, has a lot to do with preference and people's sense of how natural a space is. This outcome is useful, again, for urban designers and planners who use the currency of spatial form. And finally, my related teaching and civic engagement focuses on evidence-based design in order to provide for or better enable the delivery of both ecological, environmental, and psychological ecosystem services to cities. Thank you.